Historically, if you were to walk into a mental health clinic, you'd basically just see adults in the waiting room.
Right, yeah, mostly adults.
Yeah, and maybe, a few teenagers scattered around. But you almost never saw anyone under the age of 5.
No, definitely not.
That was just the established historical norm for decades. But today, if you walk into that exact same clinic, you are going to see preschoolers.
It's pretty shocking.
It really is. I mean, children who haven't even learned how to tie their shoes yet are now requiring actual clinical mental health support.
Yeah, and it fundamentally rewrites our understanding of who is vulnerable in our society, right? And when that vulnerability actually begins.
Exactly.
We are looking at a healthcare landscape that
Yeah.
has completely shifted under our feet.
And that jarring reality is basically the starting point for our deep dive today. So for those of you listening, we're looking at an update published by the Fulton County Center for Regional Growth.
Which is an economic development group, interestingly enough.
Right. And this update shines a spotlight on the Family Counseling Center in Gloversville, New York.
Yeah, they're currently celebrating their 50th anniversary, I think.
They are, yeah. But we aren't here to just talk about a milestone. The mission of this deep dive is to explore how this one specific local community clinic is tackling this surging nationwide mental health crisis.
And they're doing it by completely tearing down and, rebuilding their approach.
Exactly. Tearing down their approach to access, workforce integration, and holistic care. They recently went through this massive transformation that might actually serve as a blueprint for communities everywhere.
Yeah, and to truly grasp the magnitude of what the Family Counseling Center has pulled off in Gloversville, we need to look at the sheer scale of the pressure cooker they were operating inside of.
The demand, right.
Right. The surge in demand they faced wasn't just some, slight demographic shift. It was an absolute tidal wave.
And I know we all generally feel that mental health challenges have become way more prevalent, but the sources we have actually quantify this.
They do, yeah. There's a report from 2021.
From SAMHSA, right.
Exactly. The Substance Abuse and Mental Health Services Administration. And they found that mental health conditions are now affecting more than 1 in 5 adults.
Wow. 1 in 5, so like 20% of the adult population?
20%. And it isn't isolated to adults either. The Centers for Disease Control confirmed a simultaneous, really sharp increase in mental, emotional, developmental, and behavioral disorders in kids.
From ages 3 all the way up to 17.
Right, so it is hitting literally every demographic simultaneously.
So you have this 50-year-old clinic facing a system that is historically under-resourced to begin with, and then boom, the pandemic hits.
Good.
Michael Countryman, he's the chief executive officer at the center, he noted that COVID caused a 25% increase in needs across the entire spectrum.
Because the pandemic was the accelerant.
Oh, absolutely.
The isolation, the disruption of daily routines, just the ambient anxiety of it all, It pushed an already stressed system past its absolute breaking point.
Which is why we're seeing those preschoolers, like we mentioned earlier.
Exactly. That cascading need is exactly why they're now seeing preschoolers in the waiting room. The demand just completely outpaced the infrastructure.
And normally that usually leads to a total collapse of local services, right? But the turning point in this story, at least according to the source material, was a really specific designation the center attained in 2024.
The CCBHC designation.
Right. They became a certified community behavioral health clinic. And the update notes they'll be fully operational under this new model by July 1st, 2025.
Yeah, and this is where the operational reality of the clinic fundamentally changes. The CCBHC model is this federal initiative designed specifically to expand reach and resources.
To meet these surging populations we were just talking about.
Exactly. It completely alters how a clinic functions on a day-to-day basis.
Okay, but I have to push back on that a little bit.
Okay, go for it.
Because Certified Community Behavioral Health Clinic is just a long acronym. A government designation is ultimately just a piece of paper, right?
I see what you're saying.
If I'm an adult struggling with severe depression or a parent with a really anxious preschooler, a bureaucratic title doesn't treat my family. How does a designation actually translate into getting a patient through the physical doors?
Because the CCBHC designation isn't just a title. It alters the actual financial and structural mechanics of the clinic.
Okay, how so?
Well, historically, community mental health has operated on this really disjointed fee-for-service model. Or, they relied on isolated grants that barely cover the actual cost of care.
Right, always scraping by.
Exactly. But achieving CCBHC status means the clinic meets these strict, comprehensive federal standards for care, And in return, it unlocks a funding model that reimburses the actual true cost of providing those expanded services.
Oh, wow. So it's not just a grant, it's a structural change in how they get paid.
Right. It gives the clinic the financial bedrock to make massive operational leaps. And the most immediate leap they made was addressing the biggest barrier to entry in mental health care,
The wait list.
the wait list.
That makes a lot of sense. The wait list is infamous in healthcare. Countryman points out a statistic in the sources that is just, it's incredibly bleak.
Yeah, it's a tough one.
He notes that about 50% of people who experience a mental health event give up on seeking services simply because of long wait lists,
Half. Half of the people who finally decide they need help just walk away.
which is devastating. I mean, it
Yeah.
takes an immense amount of psychological energy to raise your hand and admit you are in a crisis.
It really does. And to finally do that, only to be told, hey, the earliest available appointment is in 6 months. It's just crushing.
Because the crisis is happening in that moment, not 2 seasons from now.
Exactly. So with the structural backing of the CCBHC model, the Family Counseling Center tackled that bottleneck head on.
The sources indicate they hired, what, between 50 and 60 new employees?
Yeah, 50 to 60, which is a staggering logistical achievement.
Especially right now.
Right, hiring 60 mental health professionals during a nationwide workforce shortage is incredibly difficult.
Yeah.
But because the CCBHC model provides operational stability, they could recruit aggressively.
And the direct result of that massive staffing surge is that they completely eliminated their wait list. Zero wait list.
Which is unheard of. Countrymen explicitly stated, access is no longer a barrier.
But it wasn't just a matter of throwing more personnel at the problem either, was it? They actually changed the physical layout of how care is delivered in Gloversville.
They did.
The center consolidated all of their direct care providers into a single, easy-to-access location for the clients.
Yep.
And meanwhile, they took all the administrative staff and the non-direct care providers, and they physically moved them to a completely different building nearby.
They basically optimized their physical footprint to prioritize the client. Every single square foot of their main building is now dedicated to the clinical interaction.
It totally reminds me of a restaurant manager realizing their kitchen is overwhelmed and the dining room is packed.
Yeah, exactly like that.
Instead of just hiring more chefs to, bump into each other in a tiny kitchen, they put all the chefs on the main line to maximize the meals they can cook.
Right.
And they take all the accountants, the marketing team, the inventory managers, and put them in a back office across the street. You maximize the space for the actual service being provided.
That physical reorganization is a direct reflection of their new clinical philosophy.
Mm-hmm.
But, it does raise an essential question.
What's that?
They have zero wait lists now, and they've optimized the space.
Yeah.
But is sheer volume the only metric of success?
Right. That's the big question. When a clinic completely eliminates a wait list by seeing a massive surge of patients, you really have to wonder if they are just rushing people through a revolving door just to keep the numbers down.
Yeah, just checking boxes.
Exactly. Is the actual quality of care changing or just the speed of it?
Well, the quality of care changes because the CCBHC model forces a shift from isolated treatment to highly integrated treatment.
Okay, unpack that a bit.
Historically, mental health care has been really heavily siloed. A patient might see a therapist once a week, right? And then completely separately see a primary care doctor for physical ailments.
And those two professionals almost never speak to each other.
Almost never.
The patient becomes like a courier, just carrying medical history back and forth between different offices, hoping nothing gets lost in translation.
Right. Here's what my therapist said. Here's what my doctor said. But the CCBHC structure shatters that isolation. Care is no longer provided in a vacuum.
So they actually talk to each other now.
Yes. The center now has the resources and the mandate to actively facilitate communication between a client's primary care providers and their therapists. It becomes the unified team treating the entire ecosystem of a person's health.
And to pull that off, they've created some highly specialized roles that you don't typically see in a standard counseling center, right?
Yeah, some really unique positions.
The sources mention care coordinators, whose specific job is to connect clients to broader community resources outside the clinic.
Right.
They have health coaches, and they have this role called an engagement specialist.
And the engagement specialist is perhaps the most vital operational shift for vulnerable populations.
Why is that?
Because their primary function is to manage the friction of getting care. Their whole job is to ensure that clients actually make it to their various appointments.
Which addresses a massive structural blind spot in healthcare.
Huge.
Like, a clinician can create the perfect evidence-based treatment plan, but if the patient doesn't have reliable transportation or is too overwhelmed by severe anxiety to physically leave their house.
The treatment plan is totally useless.
Exactly. It's like a personal trainer who doesn't just give you a workout plan, but actually texts you and checks in to make sure you drove to the gym.
That's a great way to put it.
The engagement specialist is there to actively manage those barriers rather than just labeling the patient as quote-unquote non-compliant when they miss an appointment.
Right. They manage the actual logistics of recovery. And beyond these specific roles, the center has expanded its overarching services too.
What else are they offering?
They now offer substance use disorder treatment, peer services, psychiatric medication management, and mobile crisis services.
Wow, that is comprehensive.
It is. Peter Lawrence, the chief operating officer, noted that this entire structure is designed to put the person at the center of what they do.
And crucially, they achieve this by partnering with other community organizations, right? So they aren't needlessly duplicating services that already exist in Fulton County.
Exactly. It's about integration, not just expansion for the sake of it.
No, if you're a patient navigating a mental health crisis, this level of highly coordinated whole person support is obviously life-changing.
Yeah.
But I want to pivot this to you, the listener, especially if you look at things through a business or community development lens.
This is where it gets really interesting.
Yeah, because if you are a local business owner in the region, why should you care about this massive investment in clinical coordination? I mean, it's worth noting that the source providing this update is the Fulton County Center for Regional Growth and Economic Development Group. Why are they publishing an update about a mental health clinic?
Because the concept of economic infrastructure is evolving.
How so?
Well, when we think of infrastructure, we traditionally envision roads, bridges, power grids, broadband internet, things that allow commerce to physically happen.
Concrete and fiber optics.
Exactly. But Sarah Preston, who is the Disability Resource Coordinator for FMS Workforce Solutions Career Center, provides a very different perspective in the source material.
What does she argue?
She argues that mental health is a fundamental pillar of workforce stability.
So she's essentially framing mental health as civic infrastructure.
Yes, exactly. Preston notes that mental health is rapidly becoming a priority for workplaces because the economic data is undeniable.
Right.
Supporting employee mental health directly boosts engagement, reduces absenteeism, and enhances overall productivity.
And the Family Counseling Center actually goes a step further in this regard, don't they? They actively assist people in finding jobs and becoming more productive participants in their daily lives.
They do. And the logic there is incredibly straightforward.
If an employee is spending, say, 3 hours of their workday trying to navigate a fragmented healthcare system to get their child a therapy appointment.
They might be physically at their desk, but they aren't actually working.
Exactly. Their focus is completely consumed by a crisis.
Countryman captures this dynamic perfectly. He states that an employee is not going to be a productive member of their team if their care needs are not met outside of work.
Makes total sense.
And the comprehensive tools provided by the CCDHC designation allow the center to meet those needs efficiently, which means the employee can actually be present and productive when they're on the clock.
The sources even mention that the clinic utilizes virtual services to accommodate the modern workday.
Yet telehealth is a huge part of this.
An employee can use the center's virtual platform to attend a therapy session without having to even leave their general work area. It eliminates travel time, keeps them integrated in their workday, and ensures they still get the vital care they need to function.
It creates a direct, quantifiable cause and effect relationship between community health and economic output.
It is treating mental health care access with the exact same economic urgency as the shovel-ready sites listed in the navigation menu of the Fulton County website.
That's a great comparison.
It's foundational preparation for regional business growth. If the local workforce isn't mentally healthy, the local economy simply cannot physically expand.
When you cure a waitlist bottleneck, you aren't just sending a healthier person back to their home. You are sending a focused, capable employee back to their workplace.
Which changes the economic math of the entire county.
Completely changes it.
But, that structural shift makes a lot of sense for the current adult workforce. But it brings me back to the jarring reality we discussed at the very beginning of this deep dive.
The preschoolers.
Right. If preschoolers are coming into the clinic needing clinical support, aren't we just treating the symptoms of a future workforce crisis?
It's a valid concern.
Fixing the adult wait list is crucial, obviously, but
Yeah.
what is happening upstream to prevent this from just compounding?
Well, following that current upstream leads directly into the local school systems.
Okay.
That's the environment where the next generation's mental health and their future economic viability is being shaped in real time. And the Family Counseling Center is actively operating in that space as well.
Right. Lawrence notes that they partner directly with school districts to address behavioral needs and to strengthen the relationships between students and their caregivers.
And the source provides a really interesting perspective on this from Dr. Sarah Chauncey. She's the superintendent of the Northville Central School District.
She runs a local district and sees the daily reality of these students. What's her take on it?
She points out that the baseline of growing up has always involved friction, right? Kids and families have always had issues to work through. But she identifies a new, highly aggravating variable in the modern environment.
I think I can guess what it is.
Yeah, she points squarely to invasive social media and 24/7 connection.
Ah, yeah.
Dr. Chauncey observes that kids are using digital platforms to say and do things they would never likely do in a face-to-face personal setting.
Because the boundaries of conflict have completely dissolved.
Exactly.
I mean, in the past, if there was a conflict at school, a student could go home at 3 o'clock and the house served as a physical sanctuary. The conflict stayed at the school.
Right, you got a break from it.
Today, a student can experience a severe toxic conflict on a screen at 11 o'clock at night, alone in their room. But the fallout from that digital conflict inevitably creeps into the physical classroom the very next morning.
It's like the physical environment of the school bears the brunt of the digital toxicity.
It's like a gas leak that happens quietly at home, but the combustion happens in the middle of third period.
Wow, yeah, that is exactly what it is. And to combat this shifting reality, Dr. Chauncey's district is taking a really proactive approach. They're running workshops designed for both the parents and the children, addressing how to actually navigate this constant connectivity.
But this raises a major logistical question for me.
What's that?
If the digital world is a constant 24/7 problem, if the toxicity literally lives in the cloud, how does a local brick-and-mortar counseling center in Gloversville actually combat that?
Yep.
A physical building can't just turn off the internet.
No, you can't. You can't fight the cloud, but you can build a resilient physical infrastructure beneath it.
Okay, I like that.
You combat a pervasive digital problem by building the exact kind of hyperlocal, deeply integrated safety net we've been discussing.
Right.
When that digital toxicity manifests as a severe behavioral crisis in a classroom, the solution isn't putting that child on a 6-month waitlist.
Because that waitlist doesn't exist anymore.
Exactly. The solution is immediate, zero waitlist access to the center's health coaches and care coordinators.
Yeah.
You create a community ecosystem where there is an entire web of connected professionals ready to catch that child and support their family the very moment the crisis occurs.
That makes total sense. We have traced a pretty incredible operational journey today, honestly.
We really have.
We started with the reality of a post-COVID healthcare landscape where preschooler anxiety is surging and where 50% of people just drop off wait lists out of sheer despair.
Yeah.
And we examined how Gloversville utilized this CCBHC designation to completely rewire their clinical infrastructure. They bypassed the standard siloed approach to create a fully integrated zero waitlist community hub.
Right.
A center that doesn't just treat illnesses in a vacuum, but actively functions as vital educational and economic infrastructure for the entire region.
And it forces a really necessary reevaluation of how we measure a community's true strength. And I want to leave you, the listener, with a thought to mull over long after this deep dive ends.
Go for it.
We traditionally view mental health as a purely individual, intensely private struggle, right?
Yeah, it's something managed quietly behind closed doors.
Exactly. But Gloversville's model proves that mental health is, in reality, a vital community ecosystem. If a town's economic growth, its workplace productivity, and the success of its local schools are all completely intertwined with the availability of local mental health care, what does that mean for the future of urban planning?
Oh, wow. It changes the entire paradigm of civic development.
It really does. When we measure a city's potential for growth, or when we look at regional development guides published by economic groups, should we be looking past the traditional physical infrastructure, past the highways, the bridges, and the shovel-ready industrial sites? Perhaps the true defining measure of a city's future capability is found by looking at the strength, the accessibility, and the integration of its mental health safety net. Because all the industrial parks in the world won't matter if the community members aren't healthy enough to actually participate in them.